what the agenda looks like today, I'll talk briefly on introduction to Done Solutions, and then I will turn this over to Vamsi, who is a manager in our application development group, and he will take the bulk of the presentation. And that'll be talking about the definition of meaningful use, why it's important, what are the stages, some of the challenges as it relates to implementing meaningful use, and then, excuse me, I'm fighting a cold, so you'll have to bear with me. And then we'll do a demo basically on a patient engagement portal that we've done. So go ahead. Done Solutions Group is a full-service IT consulting firm. We were founded in 1988. Our headquarters are just outside of Chicago. We have satellite offices in Raleigh, Minneapolis, and St. Louis, with an offshore location in Bangalore, India as well. We have multiple practice areas. The two that we really primarily concentrate on are application development and business intelligence. In our app dev group, we do everything from portals to content managed e-commerce sites, mobile app development, the traditional custom app development. We also have a business intelligence practice where obviously we do business intelligence and analytics, including building data warehouses, etc. And then we also have a predictive analytics group. We also provide training as it relates to our two practice areas. We are a certified SAP trainer as well as a Liferay trainer, offering classroom, on-site, computer-based, custom-type training. Throughout our years since 1988 doing this, we have built some specific, what I call startup or fast start frameworks to allow certain clients within certain verticals to get up to speed quickly from a business intelligence and analytics perspective. These are some of our clients. We work with Fortune 500, mid-size, government, non-for-profit. As you can see, really crosses the vertical spectrum. Some of our partnerships. Today, we'll really be highlighting our partnership with Liferay, as that's the primary tool we use for portal development. In our app dev practice, again, we do portals, whether it's customer collaboration, innovation type portals, e-commerce related websites. That includes really a variety of tool sets, including SAP's Hybris, Broadleaf, Konacart, et cetera, from an e-commerce perspective. Go ahead. Some of the Liferay services we provide, everything from helping clients from an architectural design perspective to training, including performance tuning, graphic design, et cetera. Go ahead to the next one. We've been a partner of Liferay since 2005, again providing coast-to-coast coverage, as well as offering a certified Liferay training, as well as private training and custom training. Go ahead. That's the quick overview of Done. Hopefully that wasn't too painful. I know everybody came here to really hear about meaningful use and how Liferay can be a potential solution to really address those meaningful use demands that you have. So I'm going to turn it over to Vamsi Kosaru, who is our chief resident as it relates to meaningful use, utilizing Liferay and portal development. So Vamsi, it's all yours.
Thank you, Jeff. So today we'll just basically talk about what meaningful use. I'm sure most of you already know what meaningful use is, but I would still like to go through a little basics about meaningful use, a couple of challenges that almost every hospital faces when they're trying to implement this meaningful use, and then we'll cover some topics around beyond meaningful use, what's beyond, like what's after meaningful use, and how patient engagement portals could be a solution for the challenges that the hospitals are facing today. And then I'll just do a quick demo of an existing patient engagement portal that we have. So starting with the definition of meaningful use is basically is asking hospitals to use a certified electronic health record, which in turn improves the quality, safety, and efficiency of the healthcare, and at the same time reduce the health disparities. It also talks towards engaging the patient and family members in the healthcare, in their own healthcare, and also improve the care coordination between population and public health. So why meaningful use is important? So first, we'll talk about why it is important for the patients itself. So the first and foremost thing is patients now can have access to their own personal health information. So having that access anytime they need in an electronic format would give patients the ability to look at their health information whenever they want it. And once they can access their own health information, we can really prevent a lot of medical errors, because patients are constantly engaged. Patients know what their active medication and allergy list are. If there is something missing in there, or if there is something wrong in that information, they can right away take some steps and talk to their providers to get that updated. And along the same lines, that improves the coordination and communication between patients and physicians. And at this time, we're not only talking about between patients and physicians, but also different physicians or different hospitals, or even different departments in the same hospital that has to deal with the same patient, but one department doesn't have knowledge of a surgery that went on with the patient. So it's basically, once you have this entire information open for the patient, patients can at least have this, can use that information to have that coordination between all these people involved. And also, it also empowers the patients themselves. So once they know what kind of allergies and what kind of medications they're having, one of the rules in the meaningful use suggests the EHR providers to provide educational content specific to the conditions that a patient is involved in. So that way, when I log into my portal, I would know, I can learn more about the conditions that I have, and it empowers the individuals, which will drive a lot more meaningful conversation between a physician and a patient, so patients can ask the right questions, patient can discuss all the details of the condition that a patient is in. Again, throughout the process, definitely the health disparities would obviously be reduced because of the patient involvement, and also pinpointing the gaps in the care, so we can understand where the gaps in the care are. And patient reminders is also a big piece in the meaningful use, where EHRs have to send reminders both about preventive care and also the follow-up care. So talking about from the hospitals or the financial implications of this meaningful use, the biggest incentive for the hospitals is the incentives that are provided by the government. Demonstrating meaningful use certified EHR, it takes time and resources. At the same time, government used to give financial support for hospitals to be on EHRs, and still continues to use their Medicare and Medicare resources to fund and give some incentives to the hospitals that are meaningful use certified. Eventually, I think the biggest advantage of using this meaningful use, lowering healthcare costs. Engaging patients in healthcare will eventually reduce the cost of the overall healthcare. Hospitals can also save a lot of money as these medical errors are getting reduced, and also just being transparent to the patient and other physicians that are dealing with the same patient. So I just want to briefly talk about different stages in meaningful use. There are 3 different stages. Stage 1 started in 2011. Stage 1 is mainly concentrated on capturing the data and sharing the data with other physicians and patients. And the Stage 2 is advanced clinical process. What Stage 2 does is it adds more objectives to Stage 1, and also gives more thresholds, like what percentage of users have to use EHR, what percentage of users have to look at their health records for you to be meaningful use certified. Right now, we are in this stage. It began in 2014, and there is a recent study which says that there are only less than 17% of the hospitals who are Stage 2 meaningful use certified. The stage 3 is a future stage based on the current timeline. It's supposed to begin in 2017, but it's not required until 2018. But the overall idea of stage 3 is to improve the outcomes of the healthcare system. So stage 1 and stage 2 are kind of like the base steps that we have to take in order to get the improved outcomes of the healthcare. So this is basically a simple chart on when it started and what year has which stages involved with them. Basically what I just talked about in the previous slides. So now talking about the challenges when you were trying to implement this meaningful use. So I know that there are a lot of challenges from the technology itself when hospitals are trying to get to use these EHR systems and how they have to change their processes to get the meaningful use implemented in their hospitals. But today I'm going to talk more about even when you have a EHR system, what kind of problems that usually a lot of hospitals are facing. First thing is working with multiple EHR systems. There are a lot of hospitals who are using different EHR systems for their doctor office visits versus hospital visits. So how do patients know? Patients really don't see any difference between a doctor office visit or a hospital visit. So when they want to try and find some information about their personal health care, they usually don't know which site to go to. Usually both the EHR systems have their own portals associated with them, and as a user I don't know which portal that I have to go to because I cannot really differentiate between did I visit a doctor's office or did I go to hospital, and when a doctor probably prescribed a test, like if the testing laboratory is using a different system, then that information is getting stored in a different system. So as a patient, I really don't know. That's one of the biggest challenges. And then the patient engagement. If you take a look at like a lot of the EHR systems, they're designed for patients. So they're designed for people who are already patients, but there is no way for hospitals to engage patients even before they become patients. Even like a lot of EHR systems doesn't support or are not designed to improve the health around the population or engaging the patients with the hospital even before they become a patient of the hospital. Another biggest challenge is the integration. So again, the EHR systems are not, at least today, are not designed to be integrated with other systems, but a lot of hospitals already have a lot of these systems, like probably their own building system, probably their laboratory system. And how do you integrate these systems for the patient so that he can have like the single view of his healthcare information? There's also probably a lot of education providers where they have all the content to provide the education to the patient, but they don't have the background of the patient. So how do you integrate these two so that you can really target the education content to the patients based on their profile and the conditions and the treatment that they're going through at that particular point of time? The last thing is accessing patient data. The biggest challenge here is since this information is getting resided in multiple different places, there is no easy way for the patient or even for the physicians to look at a consolidated data of a patient. Like there is no easy way for them to look at like every procedure that a patient went through, every medication that he's on in the future or in the past and right now, and all the allergies. So it's hard to consolidate and communicate this information even to the patient or even between physicians when the patient has to go through multiple physicians because of the different types of care that he needs. And when we're doing this, there is also a lot of miscommunication that happens when a patient, either the patient is not informed properly, or even if the patient knows, even if the patient is informed properly, he may, since he doesn't have that view of his entire healthcare history, he may not understand it properly, and he may be miscommunicating. Patient may be miscommunicating it back to the physician or another physician when he switches between physicians. So these are like the base challenges for implementing the meaningful use itself. But what's beyond meaningful use? Again, meaningful use is only probably the first step in engaging the patients. And there are a lot of other areas where we can still engage patients, even without taking meaningful use into consideration. One thing that I already pointed out is engaging your population even before they become your patients. Engaging them by providing them right education materials, or providing them with some kind of alerts or with some kind of information where they would still be able to come to your hospital website or your hospital portal. Even though they're not a patient, you still know some information about them, and you're trying to give them the information that's related to them. So how do we solve all these problems, right? I think the biggest solution that we're proposing is patient engagement portal. So what is a patient engagement portal? So this patient engagement portal is a horizontal portal solution which can act as your one-stop shop for every communication and every interaction that happens between your hospital and the patient, or even your hospital and any population, even before they become your patient. So again, the patient engagement portal is basically a concept of a horizontal portal, which probably your patient engagement portal will have. This is like a pretty high-level architecture of how your patient engagement portal will probably be implemented. So it should have all the features like integration options, content management, role-based access. I'll go a little deep into each one of these sections in my next slides. But basically, it's your one-stop shop. It needs to be able to gather any information from any of the other systems and be able to interact with the users from that one-stop shop perspective, where the patients are always going to come here. So these are the following are the features that we think that when you're picking this patient engagement portal, when you're trying to implement this patient engagement portal, these are the things that you have to consider and the patient engagement portals have to have when you're implementing them. The first thing is integration with existing systems. Hospitals have a lot of existing systems, which has a lot of data in those systems already. You don't, when you're picking this patient engagement portal, you don't want to pick something that cannot integrate with your existing systems. You have to be able to integrate with your existing systems, pull the data from the existing systems, and present the data back to the patient in a way that the patient understands the data. The next thing is content management system. The content management system is really crucial for any of the patient engagement portal, because there are different types of content that you want to share with your patients, and your patient engagement portal has to support all of those things. Apart from that, there is also something called content targeting framework. So what content targeting framework does is, instead of presenting the same information to every user who logs into the portal, you can actually pick features of the profile or the procedures that a patient is going through, or based on his past allergies, medications, and you can create content that's targeted to those specific users. So when I log in, I see the content that's related to me, versus when my wife logs in, she sees the content that's for her. I mean, based on her preferences, her past medications, allergies, and procedures that she has gone through. So that's also something that we have to keep in mind when picking this patient engagement portal, because pretty soon people usually don't want it. If you have like 60 different articles, they don't want to go through them. But if you have like 6 that are targeted towards them, highly likely they're going to read through them, because they know that that's important for them and for their medical conditions. And then role-based access. Since we said this patient engagement portal will be your one-stop shop, you are engaging patients even before they become your patients. So this patient engagement portal has to support different roles, where you can differentiate between your regular population versus registered population versus your patients, your existing patients, and show them different types of content. And also, the same system can also be used by administrators or content creators to log in as themselves and be able to create content and be able to edit the existing content that's on the website. And the other feature that we think is really important is add-ons. Whatever patient engagement portal solution that we're picking, it has to be able to support custom applications. most hospitals have their own custom applications already built. So we definitely have to make sure that those custom applications can be populated or ported to this patient engagement portal. So again, your patient engagement portal becomes your one-stop shop. Single sign-on is also something that's really important because sometimes some of the older systems we may not be able to receive data from those systems. At least with single sign-on solutions, it's a quick way for us to be able to, from the patient portal, sign on to other systems, not requiring the patients to retype their credentials, so that way they don't have to worry about all the credentials for different systems. Your patient engagement portal would still be the place they always come in and go to other different systems. Multi-site. What multi-site basically means is that sometimes hospitals and different health systems, they have different hospitals. A health system can have multiple hospitals inside of them, and your engagement portal should be able to support different sites, even though they may be displaying the same content, maybe they're displaying the same type of content, maybe they're designed the same, but at least be able to differentiate it. Every hospital can have their own URL. Every hospital may have their own branding that they want their website to look like, and they may have their own specific content too. Like some hospitals may have a lot more content which they want to provide. So you definitely want to keep this multi-site kind of environment where you would be able to easily create new sites for the new hospitals. And not have to really go through the same process. So once you have this site, it's easy for you to create these multiple sites, probably using some kind of template that you already created for the first site. The next thing is document management. So document management is also really important, since a lot of documents are related to the patients are going to be stored in this patient engagement portal. So the patient engagement portal platform has to support the document management system. You've got to be able to upload multiple types of documents to the system for patients to view. And something that would be really nice for the users is some kind of preview generation tool, right, where I don't have to download every document that I'm seeing in the portal. I can just click on it, read it inside of the website, and I can just leave it in my portal. I don't have to download it to my local laptop to really view it. So that's something that would really be nice. And also, a lot of document management systems today support different types of documents. When I say different types of documents, basically the metadata associated with the document can be different. So a test results can have a different type of metadata associated with them, like the doctor date, is it good or bad, or something like that, versus your regular healthcare plan may have different sort of metadata associated with it. Even though it's like, even though all the documents may be the PDFs or the Word documents or however we're generating the documents, but the metadata associated with the document can be different. So one of the features that we should be looking for in a document management system is if it supports these different types of documents. So I can associate different types of metadata with these different types of documents. The e-doctor visit is something that we think is really going to be helpful for patients. Basically, e-doctor visit meaning that your portal might want to look into your portal supporting some kind of virtual visit to your hospital, to your physicians. So there's a lot of people who don't want to go to emergency care in a lot of scenarios where it'd be easy for them if they can do an e-doctor visit from their home or their work, or using their laptops, tablets, or mobile phones. I think this is something that you should also look into when you are looking for a patient engagement portal. The last thing that I want to talk about is something called FHIR. FHIR is a Fast Healthcare Interoperability Resources. So FHIR is a new specification that our government is coming up with, which defines how you are going to expose your patient data using a definite set of API calls. This is definitely built on top of HL7 version, or I shouldn't say it's on top of, but but keeping in mind the challenges and the advantages that we had using HL7 version 2 and version 3. So it's basically a government standard which we think that a lot of EHR systems are going to come on to pretty quickly. So all your EHR systems hopefully will support this FHIR API. And what it allows us to do is we can have a single set of standards where we can use the same call against every EHR server to get the data that we are looking for. That basically reduces the development time of the consumer engagement portal by a lot, because you don't have to worry about all the different systems and different APIs that you have to go through for each one of these systems to get the data that you're looking for. So once you have this FHIR interface enabled, you basically can talk to any EHR system which is FHIR compatible using the same interface. So how it fits into the portals or the consumer engagement portal. How it fits in is basically when we are building custom applications on top of the existing features of your patient engagement portal, we can always use FHIR APIs to get the data from the other systems when we are presenting this information back to the user. So that way, when we have to change the EHR to something else, we don't have to modify the portal itself, or the portal code would still work as long as the other EHR complies to the same standard. And also, if you want to retrieve data from 2 or 3 different EHR systems, as long as they're supporting the same FHIR API and they are compatible with FHIR, it's pretty easy to add more systems. So when we want to consolidate information for the patient from different systems, we can still use the same API to get information from these multiple systems and can simply present that information back to the user. So once again, so now I'll just go a little bit deep into this architecture diagram. The integration options we talked about, content management, targeting. So you can see here that there is a FHIR service call layer, which basically will be a single piece of interface between the patient engagement portal and EMRs, or even multiple EMRs. So all the data that we are retrieving from these EMRs could be through using a FHIR service call, and that way the service layer doesn't have to change when we have to implement these multiple EMRs or multiple EHR systems. So I think that concludes my PowerPoint presentation. So I'll go into the demo of an existing patient engagement portal that we have created for. Okay, so let me go here. All right, so this is a patient engagement portal that we have created. So it's basically for Jake's Health System. This is a public page where it basically defines or gives the user an idea of what they're going to find once they log in, like viewing your records, scheduling an appointment, update information, and all this. And it also has some information about the news articles and blogs that you want to that the hospital is publishing. Again, remember, this is something that any user can see even before the login. So if you want to engage your patients before they become your users, or before they become your patients, this is the place where you would put all those kinds of information, all those kinds of alerts and anything that you want to put. So I'm going to log in as a patient. Okay, so once I log in as a patient, what I see is kind of like my dashboard view of what's going on. Right here, I could see my upcoming appointment. So I know that I have an appointment with Dr. John Smith at 10 a.m. on Wednesday, December 23rd. And on the right side here, I could see my latest lab results or quick access to my recent lab results. And also, I could have my, I can also see the latest documents that are available for me from here. Also up top here, there is a reminder that's saying that my medication is ready. So, and here simply by putting my phone number and clicking on submit, I can sign up for text alerts. So I can just provide my phone number and automatically send text anytime I have an alert saying that my medication is ready, or whatever alert that we want to communicate to the patient, so they don't have to log in here. They just have their phone handy. They'll see that their medication is ready. So the first thing I would like to show you is walk you through scheduling an appointment process. So I can click on schedule an appointment, and I can search doctors. If I know the name of the doctor, I can search the doctor based on the name or specialty, or I can even enter my zip code to look for the doctors that are in my vicinity. Since this is a demo system, we do not have a lot of doctors, so I'm just going to leave everything blank and click on search. So now I can see the results. So I can see that there's Dr. John Smith and Dana Johnson. I can pick any of the doctors to schedule an appointment. Or here, if I have any questions about anything, I just have my email link ready up there, so I can just click on it and start typing a question to the Jake's Health system. I'm going to click on schedule an appointment, and it gives me a couple of options that are available for me. It's Monday, December 17th, Saturday, December 18th, or Wednesday, December 16th, and different times that are available. I can either pick one of these times that are available, or I can say that, like, none of these dates works for me, so I'm going to filter the results based on Monday, Tuesday, and I know that I am open on Thursdays between 2 to 5, so I'm going to select Thursday between 2 to 5 and search for the times that are available during that time and go from there. So I'm going to select one of these dates right here, and it says that basically providing me a reminder that I picked December 7th at 10 a.m. with the doctor. I can just click on confirm appointment to confirm my appointment, or I can click on edit doctor or edit date to go back and pick a different doctor or pick a different date. Okay. Now let me go to the patient documents tab up here. The patient document tab basically gives me a lot of patient information. These are the documents that are available for me based on, this is my physical exam history by Dr. John Smith. So I can click on the document. I can click on viewing the document, and the document pulls up. Okay, so this is a PDF document that you can see. I don't have to download the document. I can just use right here. I know that it's hard to read. Just click on this, the zoom icon there. I can just go through the document just from my browser, even not leaving the website that or even without leaving the patient engagement portal that I'm in right now, and I can just read through the document right here. And once I'm done, I can just go back to the list of documents, and I can pick a different document. So it's pretty, so these kind of features, like having that preview right up there, would be really helpful for the patients because it makes it easy for them to read them. And if they're in a public computer setup, they're not downloading any of these documents onto those public machines. The next thing is lab results. So here I can see the lab results that I have for ABG analysis, full blood count. I can look through each one of them, and right now you could see that on 325 I have this, and the green basically indicates that I'm good, and the orange and red basically indicates I'm in the orange basically indicates that I'm not as good as it's supposed to be. It is not as good as it's supposed to be, and red basically indicates it's not good. I can click on details for any one of this, and I can get into more details about that specific test that happened, when I took it, and all that information is available for me as well. I want to go back, and I want to go to blood pressure. So the blood pressure is where we took it a little further, where you can see the details, but you can see the basics of your blood pressure. But when you click on details, we took like an existing, this application that you're seeing is basically built using FHIR API. So this is basically talking to a FHIR server, which is behind the scenes providing us all the data with, and we built this application. So what you can see here is you can see like a chart with all my BPs from 2001. You have 30 June 2001 and 4 December 2007 and 26 August 2011, where I could see the BP information, and I can hover over any of it. I'll see more information up there. I can even click on this small info icon up there, which would tell me what those legends are for, what's red is for, what's orange, green, and blue are for. So this is basically my short-term view. I can go into the long-term view, which even provides me with more details. It's going back up to 1998 until the latest results that's available up here. And I can also, up top here, there is a lot of filters that I can apply on. I can basically select some of them, and it keeps filtering the results based on what I have selected. I can even filter it based on the dates. So I can, like, if I only want to see the records between 2007 and 2011, I can just drag this slider around, and that would help me filter the results. And if I don't like this graph kind of view, I can just pick my table view, and it would still work the same way. I can increase the date ranges. I can click on any of these filters to filter it. And the calculator basically allows me to calculate what's good versus what's bad, and based on my age, BP, height, and the gender information. The important thing in this application is not the application itself, but the fact that we have used the FHIR API to build this. As long as any of the EHRs are compatible with FHIR API, we can easily point this to a FHIR capable server, and we can point it to any EHR, and we can pull information from that EHR and display this information right here for the patient. And we can also easily integrate it with multiple EHRs, like if a hospital has 2 or 3 different EHRs that has the patient information in, and as long as the EHRs are FHIR compatible, we can simply attach multiple EHRs to this, and we can get that information from multiple EHRs and display it back to the patient. So the patient doesn't have to know where this information is coming from or all that behind the scenes, and he just always comes here and gets the information that he's looking for. So let me go to, I think we covered, let me start the eDoctor. So eDoctor is basically where we're talking about the virtual doctor visit. So the first thing that it asks me is what condition that I want to look for when we are doing this eDoctor visit. I can click on submit. It basically asks me a couple of questions. Do I have fever? How long do I have symptoms? Do you have a runny nose? And it asks me if I have any medications. I can click. I can submit all the questions. And it basically asks me for my credit or debit card information for the billing purposes. I can just select the same as profile information. So if you have a profile and if you have your credit card information stored, it automatically populates all this information for you. You don't have to retype all of that again. And basically asks me to authorize and continue. I can click on enter the exam room. Save that. So it basically connects me to the server. I can actually do a visit with my doctor right there. And once I'm done with the visit, I can talk to them from here. I can basically talk to the doctor. I can explain all the symptoms. We can complete the visit, and the doctor would be able to create the patient document or any other documents that are associated with this visit in the EHR systems that they're regularly used to do. And once we're done, I can just complete my eDoctor visit, and I'm done doing my visit. So that's pretty nice feature, so that you don't have to, your patients doesn't have to go to the emergency room for things that they don't have to go to. So the last thing that I want to show you in the demo is this Learn tab. So the Learn tab basically gives me more details or the education content that is necessary for me. So I'm logged in as Sarah Green, so it knows that I am a female patient. It knows that I have chronic kidney disease. So it's basically trying to pull or push the content that's related to me into this Learn tab. So when I'm seeing this, I'm only seeing the information that is related to me as a patient. So let me quickly sign out and sign back in as a different user so that you could see the difference. So let me sign back in as a patient who is male, and he has a different profile. So if I go to Learn tab, so if you can see here that the content that I'm seeing is completely different, because the system probably knows that the cholesterol is not that good for me, so it basically is targeting the content that's related to me instead of just the generic content that everybody is going to see. So that way, this content is. So when I come here, I know that this is the information that's related to me. When I'm reading it or when I want to read it, I know that this is something that I want to read. Can click on read more for any of these articles and get into more details about the articles. I can even filter the articles based on the topics here. I can even search for the articles if I'm looking for a specific I'm looking for a specific type of education, then I can search the Learning Center using this right here. So with that, I think that concludes my my demo. So we can go back to the PowerPoint. If, we'll take any questions that you guys may have. Yeah. All right.
Yeah, if anybody has any questions, feel free to, you can submit those online, and we'll look for those and answer those as we get them. I know one question just came in, and Vamsi, I'll read the question to you as it came in. So we're a healthcare system in hospital acquisition mode. You had mentioned something about, and I forget what the feature was, but you said something about how I could make that site look and feel like it needs to.
Yeah.
Could you explain that again?
Sure. So when you're picking up any of the portal technology, what it does is it basically allows you to create different sites. So basically, a site is a website that you go to using a URL. So in the same platform, you would be able to create different websites, but behind the scenes, it's all the same technology architecture. You don't have to write different code. It's the same code that's providing the content. The thing that differs is the sites could be as different as they want to be or as similar as they want to be. So two different sites can be completely different in terms of the look and the pages that they have, the features that they support. Everything can be completely different from one side to the other side. Or even like in scenario where, let's say that 70% of your content is same for all your different websites that you're creating, you can maintain a central repository for the content. And that allows you to, like, let's say that you want to change your terms and conditions, which are probably same for all your hospitals. You don't have to go through like 10 different websites. And that also gives the ability for the administrators to easily maintain the content instead of like each hospital administrator going in and modifying the content for their hospital. And it also gives the easiness of where, like, let's say that the content is specific to your hospital admin can go in and change that content. You don't have to worry about if I'm going to change this. If I change this content, am I going to affect the 6 different other hospitals that I'm in right now? So it basically gives the ease of separation while keeping the technology platform the same, so we don't have to write code for these different hospitals.
Okay, hopefully that addressed that question. If not, ping me back. Another question here says, are there any implications as it relates to HIPAA? How does that all play in this?
So the patient engagement portal itself, should be HIPAA compliant because we are showing all the patient information to the user, and we're probably saving some of the data of the patient itself. So we have to be HIPAA compliant, and we have to maintain the security. There is a different set of steps that you have to go through. You have to make sure you're not logging patient information in plain text. You're not, you're not basically, simple stuff like not logging out the patients after a certain amount of time automatically, and making sure that one patient cannot see the information about the other patients. We just have to make sure that we're following all these steps for us to be HIPAA compliant.
All right. Are there any other questions? Well, doesn't appear so. I appreciate everybody's time today. Hopefully you got some benefit out of this. And again, if you have any questions, Just as an FYI, you want to go to that Liferay Symposium slide?
Sure.
Liferay is having a employee symposium in Chicago, actually, November 16th and 17th. You can see the information at the top. So feel free to go to that URL and get some more information on that. I will be sending out this presentation later today at the conclusion, so everybody that attended this will get a copy of this. And feel free to contact us if you have any questions on how you can set up an engagement portal.
Yep, appreciate it.
All right. Thanks very much. Bye.